today I'd like to talk to you a wee bit about alcohol and breastfeeding or lactation. Now, you can guess why I'm talking about it at this time of year. It's Christmas, yes, so we're at lots of parties and perhaps having a little bit of wine or champagne or Prosecco or whatever with our meal. So it seems very pertinent at this time of the year. However, what I'm saying is actually applicable to any time of the year. And the main headline really is that most breastfeeding mothers and parents can consume a little bit of alcohol. It's absolutely no problem. You know, a glass or two isn't going to cause any problems. The way it works is that the alcohol level in your milk matches your blood alcohol level, essentially. So you would have to be incredibly intoxicated for it to be of any sort of great amounts with it to be in your milk in order for it to match your blood alcohol level, basically. And the other thing is that you don't actually need to pump or dump. So you don't need to pump in the sense that will help metabolize it faster. That's not how it works. Your body metabolises the alcohol, and as it does so, your blood level alcohol drops, and so does your milk. So that will happen at the rate in which your body metabolises alcohol. Not any quicker, not any sooner, and pumping will not speed that up in any way. So you don't need to pump and dump to pump it off and then your milk's safe. It's all about length of time, really, that it takes for you to metabolise your alcohol. Now, there are some circumstances where you would perhaps want to pump. So, for example, if you've consumed a lot of alcohol, then obviously you have to wait for a certain period of time before you can feed your little one. That period of time depends on how many units of alcohol you've consumed. And in that time, you would probably want to pump. We really would suggest that you would pump so that you keep your milk supply up, you don't get uncomfortable, and also as well, of course, you've got to think about, you don't want to end up with blocked ducts, mastitis and things like that as well. And generally speaking, on average, the average person takes an hour to 2 hours to fully metabolise about a unit of alcohol. Of course, it is an average ballpark figure though. The other thing to think about when you are having maybe a little glass of wine or something like that and you're breastfeeding, the alcohol actually peaks in your milk usually about 30 to 60 minutes after you've consumed it, perhaps a little bit longer if you've had some food with it. So actually, the best time to feed your little one is either directly after you've just had a glass of wine, or actually whilst you're having a glass of wine. That's the best time, because it won't have reached those sort of levels of alcohol that will get into your blood and into your milk at that point. And that's sort of the best way to look at it. That said, if you've had a glass of wine, you really don't need to worry too much. We always used to say that if you are able to drive, then you're able to breastfeed. However, Scotland now do have a much lower drink driving limit, and actually that's incredibly low now, so it doesn't apply necessarily in Scotland. So the main things to take away from this is that a glass or two of wine or Prosecco or whatever is absolutely no problem. You don't need to pump off your milk to metabolise it any faster. That won't work. If you've had lots of alcohol, then yes, please do pump to keep your milk supply flowing so that you don't get any blocked ducts or mastitis. And remember that actually the biggest concern with alcohol is your ability to look after your child. That's really what we were sort of better to focus on, in a way, is that obviously, a glass or two, you're absolutely fine, and if you're able to look after your child, you're able to breastfeed, basically. I hope that makes sense. The Breastfeeding Network have got a really good fact sheet on alcohol and breastfeeding that you can look up. So that's the Breastfeeding Network, and you can have a read through that if you want as well. And of course, you can always speak to one of Maddie's medical breastfeeding counsellors. You can book a Zoom with us. There's a national breastfeeding helpline that you can phone as well. And of course, any lactation consultant that's near you would be happy to help. But otherwise, just go out there, enjoy your Christmas, enjoy your life in general, and take care. Thanks for listening. Bye.